Good afternoon. Imagine having to go back under the knife less than a year after your hernia surgery. Ouch, that sounds pretty painful. Well, the chance of this happening with traditional hernia mesh is roughly between 5 and 10% of all patients, according to WebMD.com. This is not only very costly, but also very painful. Non-woven polypropylene hernia mesh is proven to be the best implant on the market today that lowers the risk of recurrence to less than 1%, as shown in the 5-year Gdansk study. I have been in the hernia mesh business for about a year now, working with SurgiMesh here in the US. I've dedicated much of my time in research and study of the different types of mesh on the market, as well as the dynamic structure of SurgiMesh and how it drastically improves patient outcomes. I've also been educating and assisting surgeons with the use of SurgiMesh in the OR over the past 14 months. 1 out of every 10 men will develop a hernia that will need to be repaired, as reported by the MayoClinic.com. If left untreated, this hernia can become incarcerated and strangulated, which would cut off blood supply to a portion of the intestines, creating the need for urgent surgery at that point. We will cover the what's, the whys, and the hows to everything you need to know about hernia repair and how SurgiMesh is your best possible option. You or a loved one will have a hernia in the near future. SurgiMesh can provide you with the no pain and the lowest rate of recurrence in the market, less than 1%. We'll take a look at some woven and non-woven hernia mesh structures. And lastly, we'll talk about what you can do proactively to seek out SurgiMesh from your surgeon. So remember how we spoke about earlier about how 1 in every 10 men will develop a hernia? It could be you next, or maybe you already have had a surgery and are prone to recurrence. Let's dig a little deeper. Hernias are very painful and can be caused from birth defects to general muscular weakness, and which will lead to a deficit in the abdominal wall that needs to be repaired and reinforced with surgical mesh. If left untreated, serious injury or death could even occur. Let's look at some medical statistics that show why the use of SurgiMesh is proven for the best possible hernia repair. In the 5-year Gdansk study, it was shown that recurrence rates were less than 1% in all patients receiving SurgiMesh, as well as in post-op follow-up at 3, 6, and 12 months. 98.5% of all patients reported no pain. In the patient group that received the traditional woven mesh, about half of them reported chronic pain due to the mesh and due to the fact that they could feel the implant in their abdominal wall. So what does the mesh look like, and what are the differences between woven and non-woven mesh? We're going to show you. And as you can see in the first picture, it's of a woven polypropylene hernia mesh. And let me pull this up for you. This is what's on the market today. And again, this is a woven woven piece of polypropylene mesh. As you can see, it really looks as if almost really simulates a screen that you would find in your windows. It's very non-conducive to promoting healthy tissue growth and is rough, and is rough on the edges, so the surgeon, when the surgeon needs to cut it to fit the shape of the hernia, they'll actually feel it, and it's kind of sharp. In the SurgiMesh picture, which I'm going to show you next, you'll notice the non-woven structure of the mesh, which is right here. And we can blow this up for you. You see the non-woven structure of the mesh looks totally different. It does not look like a screen, and it actually simulates more of a drier sheet. So this is non-woven polypropylene. It's very soft, it's very strong, it promotes healing, healthy tissue growth in 12 days, and again it almost looks like a dryer sheet, and it can be cut to shape as it cuts just like paper. So for the surgeon, when they're cutting it down to size, it's very useful, very easy for them to use. And again, the edges are very smooth so that the patient doesn't feel those sharp edges when they move around post-operatively, which again, that reduces the chronic pain that we were talking about earlier. So again, the non-woven matrix is very strong, and another good reason to use it is it will not shrink. Woven mesh actually is woven like a woven blanket, so it can be pulled apart, thus it can shrink. The non-woven cannot be pulled apart and will not shrink, which is one of the leading causes of recurrence. When they put the mesh in, if it shrinks up to 30%, it's going to re-expose that defect area. And again, SurgiMesh will not shrink, so thus the less than 1% chance of recurrence. So now you're thinking, great, I have a solution for my hernia repair, but does my doctor know about it? And how do I ensure that I actually receive SurgiMesh as an implant should I or someone I know need hernia repair? When you go to see your surgeon, make sure you find out which type of mesh they're using and ask if they've heard of SurgiMesh. Talk to your doctor. This is the most important thing that you can do proactively. A lot of people do not speak up and do not ask questions. Make sure you talk to your doctor. This is the most important thing that you can do. If you ask for it, they will have to do their due diligence in researching the best possible option for your hernia repair. Tell them to visit surgimesh.com and ask for a rep to come visit them should they not be familiar with SurgiMesh. So in conclusion, we've discussed the need for hernia repair as it will most likely happen to you or someone you know. We've discussed the success stories and benefits of using SurgiMesh over traditional woven polypropylene hernia mesh. And we've also seen the physical differences between the two. And lastly, we've exposed the ways in which you, the patient, can have a better chance of significantly reducing your recurrence rate to less than 1% and getting the best possible outcome for yourself by asking your doctor about SurgiMesh. So don't become another statistic for hernia recurrence surgery and suffer through the long-term chronic pain associated with woven traditional mesh. Enjoy the fast 12-day tissue proliferation that happens with SurgiMesh and the no chronic pain that is associated with using our non-woven polypropylene matrix. So, you'll be back to your feet in no time. Thank you for your time, and should you or a loved one need hernia repair surgery, I look forward to seeing you in the OR and providing you with the best possible hernia mesh on the market. Thank you.